Hi friends, this is Dr. Sumana, Professor of Microbiology at JSS Medical College and Hospital attached to JSS Academy of Higher Education and Research located at Mysuru. In today's session, I'll take you through various puzzles that help you in the treatment of cystitis, that is lower urinary tract infection. In this particular slide, I have shown you the diagrammatic representation of the lower urinary tract. This is the bladder and this is the urethra, along with just the ureters. So this is just a diagrammatic representation. Now, the puzzle is you have to draw one line at a time on the above diagram that I showed and derive the letters N, A, F, E and identify the letters C, O. These letters represent the first letters of the antibiotics that can be used in the treatment of uncomplicated cystitis. This is as per the latest ICMR guidelines 2022. N is nitrofurantoin, A is amikacin, F is fosfomycin, E is ertapenem, and CO is cotrimoxazole. Now let us see how we solve the puzzle. One line at a time, say this is N. One more line, this will be A. One more line, this is F. And another line, this represents E. And this is C and O. So this is how we derived the different letters of the antibiotics that we use in the treatment of uncomplicated cystitis. N, A, F, E and CO. Now, if we rearrange those letters or the abbreviations that we had or the first letters of the antibiotics we had, you can derive this N fecal, which is normal fecal commensal. So what are these? N is nitrofurantoin, F is fosfomycin, A is amikacin, E is ertapenem, and CO is cotrimoxazole. And now I have one more puzzle for you. This is called Fun with Numbers. Here I give you the dosage of all these antibiotics and the duration of treatment. And the challenge for you is using only numbers 0, 1, 2 and 3. You have to fill up the table. Now let us see what the dosage is. Nitrofurantoin 100 milligrams 2 times daily for 7 days. Fosfomycin is used at a dose of 3 gram just once. Amikacin is used at a dose of 15 milligram per kg as a single dose and maybe in the upper urinary tract infection. Later, you may use amikacin based on the creatinine clearance. And ertapenem is again used as a single dose at 1 gram. And cotrimoxazole is used at a dose of 960 milligram 2 times daily for 3 to 5 days. So now I have represented this table. So this is the dose in milligram or gram, whatever it is. And this column represents the number of times per day and this represents the duration. Now let us see how we solve this puzzle. See, nitrofurantoin 100 mg is just written there without any change because you have 1 and 0 zeros. Number of times per day, it is 2 times. And the duration 7 is represented as 3 plus 3 plus 1, that will be 7. Very simple primary school mathematics. Now, cotrimoxazole 960 mg is represented as 320 into 3, that becomes 960 milligram. Number of times 2 times and duration 3 to 5 days is represented as 3 written unchanged and then 5 is represented as 3 plus 2. Now, amikacin 15 milligram per kg is represented like this. 3 into 3, that will be 9. plus 3 into 2, that will be 6. So 9 plus 6 will be 15 milligram per kg given as a single dose. And phosphomycin doesn't require any change. 3 gram is represented like this. And just start dose is given. And similarly, ertapenem is given at 1 gram as a single dose. So this is how, using just the numbers 0, 1, 2 and 3, we are going to fill up this table. Another important point to be noted is, you please avoid urinary quinolones and cefuroxime in the treatment of uncomplicated cystitis because they have developed a lot of resistance. And do not use third and fourth generation cephalosporins. Here they may be used if it is sensitive, but reserve this third and fourth generation cephalosporins for the treatment of pyelonephritis or upper urinary tract infection. Thank you friends for viewing this video. Please like, share and subscribe to my YouTube channel.